Hi everyone, my name is Julia O'Connor. I'm a clinical social worker by training, and I currently serve as the Health and Social Policy Advisor at the state's Workforce Board, where I manage several policy portfolios, including leading the state's legislative and advocacy strategy regarding the behavioral health workforce. In other words, I'm a macro-level social worker for micro-level social workers. I came to the social work field from the policy field, having previously spent nearly a decade in public service, including several years as a congressional staffer in Washington, D.C. While I loved working on Capitol Hill and was honored to serve the Washington delegation, my home team, if you will, I began to feel disconnected from the community and the person-centered work that was being done at home, and I wanted to further explore my passion for behavioral health access and service. I returned to my hometown of Seattle, and I enrolled in Seattle University's MSW program, where I was immediately immersed in the world of social work practice, the history and the theories of our field, the communities and the client populations that are engaged within social work, the many systems impacting both social workers and our clients, as well as the intersectional impacts of those systems, the policies that define and regulate those systems, and of course, the copious barriers faced by both clients and social workers in navigating those systems. The social justice and racial equity framework employed by the faculty in my MSW program strove to place particular emphasis on understanding not just the fundamentals of social work practice, but also our responsibility to call out systems of injustice and to actively work for equitable anti-racist practice. Despite having the good fortune to spend a year each at the King County Department of Public Defense and at Atlantic Street Center, I found myself increasingly interested in the role that social workers can play at the macro level, especially in the development and the creation of public policy. I hope to bring the clinical training and social justice lens of my MSW program into macro practice, and luckily for me, such work exists. In 2019, I joined the Workforce Board, where I've led a project addressing 5 particular barriers facing the behavioral health workforce. This project, which was funded by the legislature in 2019, required us to convene stakeholders from across the state to address 5 barriers, as I mentioned, including reimbursement and incentives for the supervision of interns and trainees. In other words, identifying barriers faced by the community behavioral health system, which plays such a vital training role in developing behavioral health workers, but also faces really significant challenges to retaining those workers after they've received independent clinical licensure. We were also looking at supervision requirements, competency-based training, licensing reciprocity, and background checks, including barriers related to an applicant's justice system involvement or substance use disorder history. With the collaboration of nearly 300 stakeholders from all across Washington state, including, of course, many social workers, we developed approximately 20 actionable policy recommendations, which were submitted to the governor and to the legislature at the end of 2020. I'd like to highlight a few of those recommendations that are especially applicable to social workers. We recommended developing and implementing a funding mechanism, such as a teaching clinic enhancement rate, that recognizes and supports community behavioral health agencies that perform a significant training function required for behavioral health workers to obtain both their educational degree, but also their postgraduate clinical licensure. We also recommended strengthening and funding loan repayment programs that would incentivize direct service and clinical behavioral health supervision and provision. We recommended removing barriers to teleprecepting for supervision both in clinical practicum sites as well as fully employed pre-licensure settings. We recommended developing a crosswalk of licensure, portability, and reciprocity requirements, and also anticipating a possible increase in behavioral health workers in emergency services and first responder roles. Of course, these are just a few examples. The full report and all 20 recommendations are available on the Workforce Board's website. We're now in the process of working with members of the state legislature and the staff to the governor to advocate for turning these recommendations into legislation and funding priorities. We're about 5 weeks into the 2021 legislative session, so we still have lots of work ahead of us, but we're excited about several bills which are positive changes for social workers. Some of these items that I'd like to highlight for you include House Bill 1007 from Representative Clippert. This removes the limitations on the number of supervised experience hours that a person pursuing a license as a social worker may complete through distance supervision. In other words, this removes the limit of the 40 distance supervision hours for face-to-face supervision that you previously had while pursuing your clinical license. There's also House Bill 1063 from Representative Harris, which provides additional credential renewals for certain behavioral health associates during periods of governor-declared emergencies. This bill will allow social workers with associate licensure to receive a waiver permitting additional renewals during a governor-declared emergency like the ongoing COVID pandemic. Amidst this pandemic, we know some folks have struggled to meet the required hours for licensure within the established time limit, so this bill would allow additional time to complete those hours. House Bill 1196 from Representative Riccelli, as well as Senate Bill 5325 from Senator Mazzal, which is the companion bill, requires reimbursement for audio-only telemedicine services. This bill would require insurance companies, including Medicaid managed care organizations, to reimburse for audio-only telemedicine, i.e. not Zoom or other telemedicine video platforms, at the same rate as an in-person or video telemedicine service. We know that many clients aren't able to access video or in-person face-to-face services, especially during this pandemic, so this would help to rectify that access issue. House Bill 1444 from Representative Rule, who herself is a social worker, creates a temporary limited school mental health staff certificate for Department of Health licensed behavioral health professionals. That includes social workers. And this is for the purpose of providing trauma-informed counseling and supports to students who are impacted by the COVID-19 pandemic. Finally, I'd like to highlight House Bill 1504 from Representative Chop, which would do many different things, but a few of them are particularly pertinent to social workers. This includes establishing a behavioral health workforce pilot program and providing training support grants to community mental health and substance use disorder treatment providers. The bill also increases the amount of funding appropriated to the Behavioral Health Loan Repayment Program, which would expand the number of workers, including social workers, who are able to participate in the program. It's of course important to note that these bills, as of this video recording, have not been signed into law, but they are exciting developments that advocate for positive changes for social workers in our state. I know this might seem like a lot of very technical language that also has to move through the legislative process, which of course by design is not a speedy one, and it can be quite intimidating. But there are many different ways for social workers to involve themselves in policy discussions and macro level change. In fact, NASW Washington is a fantastic resource for those looking to get started or who are curious about how to get more involved. I think it's important to note that social workers bring an incredibly valuable lens to the policy realm. Our knowledge of systems and their real-time impact on the individuals, the families, and the communities with whom they'll interact is vital to developing and implementing public policy that will serve just as well in actual practice as it does in theory. Thanks.